Are you feeling burned out trying to run every aspect of your healthcare business? Here are 5 techniques that a practice manager, someone who is leading your business, will use to make sure it runs smoothly and take pressure off you and your staff. Private practice owners, are you ready to rewrite the rules for your practice so you can have more time off, a great team, and more income while delivering better patient care? Then you are in the right place. Welcome to the Provider's Edge podcast. I'm your host, Sabrina Runbeck. I'm a provider, an international peak performance keynote speaker, and a best-selling author. My guests and I help providers like you control your practice, control your life, control your future. This is your defining moment to be a disruptor in healthcare. Business owners and medical professionals are experiencing substantial and consistent growth at an astonishing rate by utilizing the power of practice management planning. But what exactly is practice management planning? Well, if you ask 10 people for the definition, you'll probably get 10 different answers. Essentially, practice management is the supervision of all business aspects of a practice. A practice manager does not provide healthcare directly to the patients, but they do provide a service that is critical to your patient's well-being and business growth. Practice managers spend their day overseeing many of the operations that medical professionals do not have time, energy, or knowledge to oversee themselves. These operations can include many things like finances, information technology, human resources, compliance, and marketing. That's just the tip of the proverbial iceberg. However, let's dive deeper into the ways that practice management can help your business reach new levels of efficiency and growth. This podcast is sponsored by Sabrina Runbeck, LLC, as I am the one here with the big mission to celebrate our work in the healthcare space and supporting you to become a high-performing healthcare business owner so you can create bigger social impact. Don't forget, we have our monthly healthcare disruptor think tank. Go to sabrinarunbeck.com/community. This is a group of healthcare leaders, executives, and business owners who are invited into a group of less than 30 people where we meet once a month to help spotlight each other's work and strategize in how can we continue to grow further together. Number 1, analyze the current workflow of your practice. The most important task of a practice manager is to frequently do an in-depth analysis of your business workflow. They will be continuously working to find the errors in your daily operation that are costing you the most time and money. Part of this process will more than likely be involved by gathering patient and staff feedback. An in-depth analysis of your workflow will help you make decisions and find solutions based on real data instead of just gut feelings. Number 2, make new goals and translating them into actions. Practice managers are especially trained to use the data from their in-depth analysis of your business to identify clear and concise goals that can be easily translated into actions. It is important that they make long and short-term goals. Additionally, it is important to give adequate attention to and design specific goals for each department. I just recently had this extensive conversation on how to create your best first quarter goals and not just writing down a bunch of stuff and then position them into different months or weeks with deadlines. Metrics is needed, but you also have to start by evaluating how well you're performing the last quarter. What do you need to keep? What more experience you have to create, and how are these specific goals aligning with your practice mission, your health business's revenue growth. And everything has to be very much planned out in detail, and make sure that they are using the smarter goal strategy. The extra ER does have a greater impact, not just the typical SMART goal strategies. Number 3, executing tasks by taking advantage of new information technology. Technology in the medical industry, like remote patient monitoring system, chronic disease monitoring, telemedicine, remote therapy monitoring, remote cardiac rehab, are redefining what it means to give patients the best care possible. They are the extension of our existing in-house staff, therefore can help reduce the stress and the time spent on care coordination and tracking and monitoring how well your patients are doing when they're not seeing you in person. Practice managers should learn and be knowledgeable about the latest technology available to you. Utilize these new and exciting technology can help you notice change in your patient faster than ever. And these have been shown to reduce emergency uses, hospitalization, and improve patient outcome as well as patient satisfaction. That means a decrease in how much your patient need to spend and save their time and money as well. Number 4, optimizing financial processing. The medical industry is known to have some of the most difficult and confusing way to navigate billing system or understand what type of services are being covered. Patients are often paying via insurance or through government programs, rather than paying in cash with credit card. Now, there are movements with many physicians opening up the concierge medicine practices. Financial matters like these can be finicky and leave medical professionals scratching their heads, buried under mountains, piles of documents. Practice managers are great at hunting out those easily missed inefficiencies that can start to really add up. Number 5, measuring results and evaluating effectiveness. The job of a practice manager is never over. They should be consistently reviewing the operations of all departments and trying to find the efficiency in your system. A monthly meeting with your practice manager is encouraged so you can stay up to date on the results and effectiveness of these strategies being implemented. As you can see, being proactive about management planning is pivotal in making sure your business is experiencing continuous improvement and growth. Without a practice manager, you're biting off more than you can chew and are at a serious risk of burnout. Being a medical professional is tough enough as it is, and you and your patient deserve to feel healthy, both physically and mentally. Understand how to delegate these other operational side of tasks to a practice manager, and evaluating and spotting and attracting the right practice manager is crucial in your healthcare business. If you're ready to take a look at your business under a microscope and start operating at maximum efficiency, and if you're looking to save a day of work while increasing your team's productivity, we can work together to figure out what's the health score of your business right now and give you a plan to execute so you have the right staff, the right system, and the right resources to continue up-leveling your work and your social impact in the healthcare space. Book a call, go to sabrinarunbeck.com/blueprint. See if we can create that blueprint for you. Thank Thank you for listening to today's episode. If you're like me who just want to get to the bottom and find out what's going on in your practice, then I invite you to book a complimentary peak performance diagnostic call with me. You can check my availability at sabrinarunbeck.com/blueprint to find a time that works for you. This is especially beneficial for you if you have an established clinic but now feeling drained, want to do more for your patients but are limited in your capacity, or are unable to live up to your full potential. Don't you agree that if you don't allow a pair of unbiased eyes to take a look, you'll never know what you don't know? This is your chance to gain back time and be a peak performing healthcare leader again.
She really gets the conversation. She understands. She's an incredible listener. We were talking about worthiness, and she really understands the concept of it, how it affects people in their businesses, in their clinics, in their daily life, in their relationships. So I just want to encourage you to, one, listen to our show, but to jump on board and start listening to this woman, because she has so much insight and wisdom that you don't want to miss out.
Now, open up a browser and type in sabrinarunbeck.com/blueprint. Let's create a blueprint for you to gain back a day per week and creating more impact, income, and freedom in your day. We'll talk soon.